Good evening and welcome everyone to our Technical Assistance webinar for Adolescent Sexual Health Innovation Hubs, the Teen Pregnancy Prevention Program Tier 2 funding opportunity. This webinar is being offered in English y en español. Select the globe at the bottom right of your screen and please select your preferred language. And I'll introduce Diana, our Spanish language interpreter, to provide additional instruction. Diana, are you there? Okay, in that case, my colleague Minju has dropped into the chat box additional instruction for how to select your interpretation needs. We will be moving forward with both English language and Spanish language translation. My name is Lizzie LaFerrier, and I am the Innovation Advisor at the Office of Population Affairs in the U.S. Department of Health and Human Services. I'm not here alone. However, I'm joined this evening by our incredible team. That includes Diana Silva, our Spanish language interpreter. Diana, have you been moved back into our room? I think she might still be in the Spanish language room. Bill, can we just confirm that it works perfect. Great. Wonderful. So in addition to Diana and myself, I'm joined today by Minju Kim and Jackie McCain, both project officers who will be active in the chat and here to help you troubleshoot as you need them. Jacqueline Ruiz is also joining us. She is the TPP program lead at the Office of Population Affairs, and Dwayne Barlow, branch chief in the Grants and Acquisition Management Division, or GAM, who will be co-presenting today on the administration and financial aspects of this particular funding opportunity. So before we get started with content for the Notice of Funding opportunity, let's cover some high-level logistics. All lines are muted. Chats will be going to our panelists and moderators only, and not to other participants. So use the chat function to request any technical support that you might need, or to ask questions of our staff. And yes, we will anticipate the question. We do plan on making all webinar materials available. They'll be posted to the grants.gov page and cross-posted on the OPA website. That way, we suggest you also subscribe to alerts about this particular grant announcement on the grants.gov page, and we'll show you how to do that in just 1 second. To subscribe, you're going to simply go to the web page that we'll be dropping in the chat, and that I'll share on my screen in 2 minutes. And you click the big red subscribe button on the top right and sign in to finish the process. So here's our game plan for this evening. First, we have a few more housekeeping details that we'll want to cover. Then we'll discuss the basics. What is the Office of Population Affairs, or OPA? And what is the Teen Pregnancy Prevention Program, or TPP? Next, we know that sometimes it helps to actually see the real thing that you need. And so we are going to show you how to get all the content you need online. For the rest of our webinar today, we will dive into the new funding opportunity itself, the Adolescent Sexual Health Innovation Hubs, or just Innovation Hubs, or Hubs for short. OPA will present first on an overview of this funding opportunity, and then we'll describe our expectations, the federal substantial involvement terms, application content, and review criteria. Then I'll pass to my colleague Dwayne, who will cover the grants management aspects of this process. And those include eligibility, application content format and submission, review information, federal award information, and some tips for submission. Will not be answering any live questions this evening as part of the webinar. However, we are collecting all of your questions and plan to answer them as part of our standard Q&A process. So if you have a question today, please type it into the chat, or you can send us an email. You can use either the email addresses you see on the screen. If you have a programmatic question, send it to TPP23 Tier 2 hubs at HHS.gov. You can also send it to my name email, elizabeth.laferrier at hhs.gov. Just know that we redirect all questions about the NOFO to that other hub's email, so they all will end up in the same place. If you do have any financial or administrative questions related to this funding opportunity, please contact Dwayne Barlow at dwayne.barlow@hhs.gov. A question we often get is, why are we not answering questions live or immediately after we send them in? As a federal office, we take fairness, accuracy, and transparency very seriously in this process. We cannot give any one applicant an unfair advantage in applying for these grants. All question responses should be available to all applicants. Behind the scenes, when you send in a question, we have our small team coordinating dozens of questions that we receive each week across all open funding opportunities. And then approximately each week, we will post a compilation of all answered questions to our grants.gov webpage. And this is another reminder to subscribe to that grants page. We've already discussed what we will cover today, so what will we not cover? We will not be reading the Notice of Funding Opportunity, or NOFO, verbatim, nor will we cover all of the details covered in it. That would make for a very unhelpful and unpleasant 5-hour webinar. So instead, please make sure that you read the entire funding announcement in full. The NOFO does provide you with the complete guidance to formulate and submit your application for this opportunity. The information provided in the NOFO takes precedence, and this webinar should not replace your own thorough review of the NOFO. I will say most questions that we get in our mailbox are answered verbatim in the NOFO document, so save yourself time waiting for a response and read the NOFO. Another thing we won't be doing today or any time thereafter is provide any direct consultation on the validity or promise of your individual proposal. Again, please read the NOFO in full, create your best proposal based on the available submission requirements and scoring criteria, and submit. Okay, so now it's time to get to the good stuff. We're going to quickly show you online what those 2 pages that we've talked about look like and how to access them. So I'm going to quickly share my screen and show you first what that grants.gov page looks like. So here you can see grants.gov, where you can see all the information you need to know about the funding opportunity. You can see here our funding opportunity number. So you can either go directly to the URL that we'll share in the chat or search for it up here in the keyword. A couple things I want to call out are that subscribe button. Please subscribe to this particular opportunity so you'll get updates such as when we upload new Q&A documents. And of course, here is your apply button. The thing that I really do want to call your attention to, however, is under related documents. This is where you're going to go to find those Q&As. So once we get our first one posted in the next week or so, we will upload it here and you'll see it as a Q&A file. Other files you can see related to this particular opportunity are here as well, such as the NOFO itself and other supporting documents, such as some of the figures, just as standalone PDFs. So make sure you favorite this on your browser, come here regularly, and subscribe. The other major resource we have available to you is our OPA funding opportunities page. Here you'll see all the information you need as well. So if you click on the Tier 2 Adolescent Sexual Health Innovation Hubs link, it will take you to a few different expand collapse boxes that in many ways will take you right back to that grants.gov page, but at least you have it all in one place. So here, for instance, you can see the funding opportunity itself. You can see how to ask questions, and you can see some additional resources here, which are all public facing and available to you at any point. The one additional thing I'll mention is here you can see access to our today's webinar, I should say, but we're also hosting a series of general webinars relevant to TPP, but not specific to these NOFOs. So for instance, we have one upcoming on formative evaluation approaches appropriate when developing an innovative intervention. None of these are required viewing webinars. None of these are specific to NOFOs. But we thought this might be a relevant opportunity and thought it was important to share. So you'll just click here to register on WebEx. And if you're interested, we will see you there on April 26th. So going back into our slides, if you have any questions about our two major webpage resources, just drop them in the chat. Okay, let's begin with some of our introductory content here. OPA promotes health across the reproductive lifespan through innovative, evidence-based adolescent health and family planning programs, services, strategic partnerships, evaluation, and research. We are one office within the larger Office of the Assistant Secretary for Health, or OASH, along with the Division of Grants and Acquisition Management, or GAM, which is where Dwayne works. OPA manages a number of projects under this particular mission, and among those, OPA administers the Teen Pregnancy Prevention Program, or TPP. The TPP program is a national evidence-based grant program that helps provide adolescents with the support, confidence, and resources to thrive, be healthy, and achieve their goals. The TPP program was established in 2010 with a congressional mandate to replicate programs proven effective through rigorous evaluation to reduce teen pregnancy, behavioral risk factors underlying teen pregnancy, or other associated risk factors. This mandate also calls for research and demonstration grants to develop, replicate, refine, and test additional models and effective strategies for preventing teen pregnancy, or Tier 2. OPA has 3 different TPP program funding opportunities that are launching this year. The first is Advancing Equity in Adolescent Health through Evidence-Based Teen Pregnancy Prevention Programs and Services. This is our Tier 1 replication grant. It is our largest grant cohort, and you'll note here that this funding opportunity has already closed. The second is our Rigorous Impact Evaluation grants. This is a Tier 2 grant cohort. We anticipate awarding 16 new impact evaluation projects. This opportunity is still open. The third and final opportunity currently available is this opportunity, which we're discussing today, the Adolescent Sexual Health Innovation Hubs. This is also a Tier 2 grant cohort. We anticipate about 6 to 8 awards for this. So please make sure you apply for the correct opportunity. All 3 are very different, and I'm showing them here today because we do get some confusion in past years and folks accidentally apply for the wrong opportunity. So what is the best way to know which opportunity is the right opportunity for you? You guessed it, it's to read the NOFO. If you have any questions about what differentiates these 3 different funding opportunities, just drop it in the chat. And even though these 3 very different funding opportunities are unique and have different goals and purposes, it's important for you to understand how all TPP projects fit in together. TPP projects interact along an innovation to scale continuum. And together, our TPP grantees generate, test, evaluate, and scale effective TPP approaches and innovative practices. So how does this all work? Well, in response to gaps in the TPP evidence base, new or improved approaches are generated, tested, and refined, and project teams evaluate for impact those approaches deemed most promising. These are our Tier 2 innovation and evaluation projects that you see here in the purple, blue, and teal. In communities across the country, other projects deliver those evidence-based approaches to hundreds of thousands of young people as part of their holistic efforts to advance health equity. These are our Tier 1 replication projects, and you see them here in green. Our dynamic model integrates innovation, learning, and constant feedback across all of these stages. And that's what ensures that our TPP program can continue to be impactful, yes, but also be incredibly responsive to our communities and our community's needs. So now we'd love to know who is here with us today and what your experience looks like with our Tier 2 TPP grant program. Is this your first time applying for a Tier 2 Innovation Award? In the chat, send one of the following answers to a panelist. You can either select 1, 0, or question mark, where 1 means yes, this is absolutely our first time applying. 0 means no, been there, done that. We've been with you before. Question mark means not sure, maybe we were part of one, maybe not. We'll give you a minute to respond. Okay, we're seeing a really good mix here. It looks like about half and half so far, with a few folks unsure. Okay, we're edging towards kind of more veterans, but I think it's still a really, really good mix in applicants. That's fantastic. Well, that's helpful context as we move into the next stage, which is better understanding what these innovation hubs are all about. And again, I will call them innovation hubs. I'll call them hubs. They both mean the same things. It's just trying to keep things short so I don't keep you here all night. Let's start with an overview first. For purposes of this particular opportunity, innovation refers to the ability to generate and execute new ideas, and it starts with creativity. Creativity is the ability to look past the obvious, to transcend traditional ways of seeing the world, to create something new. For the TPP program, innovation reflects a broad spectrum and an expansive spectrum of new or adapted products, programming, strategies, interventions, policies, practices that aim to prevent unintended teen pregnancy, prevent STIs among adolescents, and promote positive youth development. We further differentiate innovations by their pathway to future scale delivery. Some innovations move through development and testing stages to impact evaluation and eventually become what we call evidence-based TPP programs, or EBPs, which we describe in the Tier 1 funding opportunity as, quote, those programs that have been proven effective through rigorous evaluation to reduce teen pregnancy, behavioral risk factors underlying teen pregnancy, or other associated risk factors. Other innovations that come out of our innovation programs, however, are designed as innovative practices that youth-serving organizations may employ as part of their holistic, broad approach to teen pregnancy prevention and positive youth development. These would not be considered EBPs or evidence-based approaches according to the current Tier 1 definition. However, these innovative practices are equally valuable and welcome under this grant opportunity. So one very important note for this: evidence standards evolve over time, and therefore so too should the ways in which we define and conceptualize innovation in its pathway to scale. In 2022, the TPP Evidence Review, or TPER, announced a new protocol for identifying programs that impact teen pregnancy, STIs, and associated risk factors. The updated evidence review outlining qualifying programs is expected to launch this year, in 2023. It is possible, therefore, that future evidence standards may account more broadly for evidence-backed components of these broader approaches, or what we might encompass and be currently calling innovative practices. Regardless of what we call the innovations that emerge from this program, please know that we will continue to work very closely with all of our innovators in developing the best framing, evaluation approaches, and pathways to scale for each unique innovation. As I mentioned earlier, the TPP program was established in 2010. In 2015, after our first grant cohort concluded, OPA started to intentionally fund the development and early testing of innovations, in addition to impact evaluation under Tier 2. As a result, over the past 8 years, Our innovators have generated well over 100 unique TPP innovations at all social ecological levels for diverse users and populations, leveraging diverse modalities and more. This means that both many promising innovations currently exist that could continue being workshopped, refined, and advanced, but also that we must continue to explore and test entirely new approaches if we are to advance a more equitable pool of evidence-based TPP. So here we are. Our history presents us with a unique and incredibly important opportunity. So we ask, how might we both generate new and advance existing teen pregnancy prevention innovations and most effectively ready them for future scaling or impact evaluation? Our answer is innovation hubs. Innovation hubs are meant to serve as intermediaries in the innovation development process. They create the structure, processes, and supports to facilitate others' innovation. And they recruit and train multiple small teams, including young people, to go through their innovation process and create TPP innovations. We have two main types of hubs. We have incubators and accelerators, and I'll go into those next. But we're also allowing applicants to apply as hybrid versions. We expect 6 to 8 innovation hubs to be funded, and if over the course of 5 years, each hub supports, say, 15 to 20 innovation teams, we anticipate that 100 or more innovations might emerge as a result of these incredible projects. So let's go into them in more detail. So I'm going to repeat one point from the prior slide because it's so important. Innovation hubs are intermediaries. They are not themselves designing or testing innovations intended to promote positive youth development or reduce teen pregnancy, STIs, or associated risk factors. Instead, they identify and support multiple cohorts of teens who themselves generate and test their own unique innovations. One small note here is a hub may select a team that includes hub staff, but that's the exception. It's not the norm. This NOFO truly is aiming to support an expansive and growing community of innovators, and not just one existing organization or network. Let's spread that innovation wealth together. As intermediaries, our hubs oversee innovation pipelines and recruit innovation teams to generate, test, and refine new or improved approaches that address gaps in the evidence base. Pipelines should be defined, rigorous, and dynamic structures that enable IDTs to advance innovations through appropriate but progressive developmental phases marked by specific milestones and phase-specific supports. Pipeline phases should be theory-driven and align with a specific hub type. Please know that we are not prescriptive in exactly what innovation methodologies, science, approaches, and milestones a hub must use. Instead, we are relying on our applicants to use their creativity, their experience, and innovation science to guide their approach. So let's go into each hub type in more detail. So incubators are supporting innovation teams in generating innovations from scratch. So they are helping innovation development teams explore gaps and user needs and build ideas through to prototype using participatory design methods. For testing and evaluation purposes, they're helping their teams focus on formative evaluation activities in support of those goals of exploration, development, and refinement. Accelerators are supporting multiple cohorts of innovation development teams that have existing promising prototypes to evaluate and prepare them for future evaluation, new funding opportunities, or dissemination. Accelerators are primarily supporting IDT's early summative evaluation work to assess innovation promise, document functioning, foster innovation refinement, and produce foundational information to help them plan and make the case for future rigorous impact evaluation. Applicants also have the option to apply as hybrid models, as I mentioned earlier, and we leave that possibility open, but please do read the NOFO carefully, especially scoring criteria if you're interested in applying as a hybrid. It's important that you understand the case that you need to make for why this hybrid option is more likely to yield the outcomes desired by this grant opportunity. And now let's move to innovation development teams. We know that innovation works best when small and agile teams or groups. And innovation hubs will develop processes to identify and support multiple cohorts of innovation teams through their pipeline. IDTs, as I'll call them going forward, are comprised of diverse individuals, including those with lived experience, including young people, and they'll be identified according to the standards and processes identified by the hub. So one important note here, IDTs are the project entities that develop and advance the TPP innovations, not the innovation hub, right? If you have questions about that in particular, drop them in the chat. And finally, this new cohort of innovation hubs is designed very, very intentionally to lead a dynamic, phased, and equity-focused approach with and for young people. So what does that mean? First is dynamic. So each hub is expected to support multiple staggered cohorts of IDTs. That's important for a number of reasons, including we want to generate kind of multiple innovations from this project, but we also want to make sure there are opportunities for IDTs to move back and forth between hub types over the course of a period of performance, depending on their needs, how well their innovations are doing, and the hub selection processes. So let's take an example. Say an IDT competes in incubator sprint, has a promising prototype and wants to take their innovation to the next level. So they apply to join an accelerator, and then they get accelerator-based supports. Let's say that's piloting, testing, and preparing their innovation for the next stage. Alternatively, an accelerator's IDT with promising exploratory research, but a prototype that doesn't resonate with the kiddos may consider returning to that ideation stage and building with a new incubator and applying critical new knowledge from its prototype testing process. Another way that hubs are dynamic is in their deep connection and responsiveness to the greater adolescent health community. And hubs should establish deep, meaningful partnerships and feedback loops with the field, which includes other TPP grantees and even Title X family planning recipients. Next is phased. Historically, TPP innovators have excelled in exploratory research, idea generation, prototyping, and even early user testing stages. But we learned we really need to make a greater investment in later stage innovation work to make sure that more promising prototypes successfully move through to impact evaluation and eventual large-scale implementation. And that's why we're funding a phased approach that requires much more discipline and rigor in moving through developmentally appropriate phases and performance milestones. And last but not least, equity. Hubs should prioritize IDTs that are inclusive of young people and people with diverse experiences. And teams should strive to generate innovations that enhance individual skills or competencies or reimagine systems, policies, and environments, all in service of advancing health equity. By generating innovations and data to support new approaches for health promotion, hubs will foster a broader, more inclusive evidence base for implementation recipients, such as Tier 1 recipients, to pull from. It may also help us expand our approach to evidence. And finally, I'm not going to read through this in detail, but I do want you to take a look on page 68 at our logic model. For the short-term outcomes, we're hoping to advance through this project as well as the longer-term outcomes. And think about the ways in which we are targeting both innovation capacity, user involvement, and new and improved means of innovation, but also ways in which we're helping to promote more successful advancement of early stage promising innovations to the next step, and therefore expanding the number of evidence-based programs available to Tier 1 and the diversity and options available. So we do know that innovation processes can seem abstract. And so what we want to propose is walking through a fake example journey. So this is a made-up example. We just want to illustrate the dynamics of our TPP continuum and hopefully make it feel much more tangible. So like I said, there are many ways that innovations can move through our processes and eventually be scaled, but hopefully this helps you kind of see how it might work out. So let's start by meeting our three leading actors. First up, we have our two grantees. We have Futures Incubator, our incubator innovation hub, and we have Health for All Accelerator. This is our accelerator innovation hub. Then we have our innovation team that's working on an innovation itself. Our innovation development team calls itself the Justice Coalition, or Justice Co for short. Justice Co consists of about 5 people who work on issues related to youth and juvenile justice, and some were impacted by justice system involvement themselves. So Justice Co is really interested in disrupting disparities and outcomes for youth in the juvenile justice system. They know that what's out there now isn't working. Maybe the programs don't resonate with youth. Maybe the facilities don't have time for longer programs that are typical, or maybe the programs out there are stigmatizing or don't resonate with the facilities or the young people. They don't know why now, but they want to find out. So they apply and are selected to participate in the Futures Incubator project. Over the next 7 months, they go through a design sprint with the Futures Incubator, and they use the incubator supports, coaching, and incentives to conduct focus groups with young people and with juvenile security officers and social workers. And through that process, they identify that the major problem they want to address is that the probation officers are forced to do a lot more work than they should. And that includes having to talk about sex and answer lots of questions about sex and connect young people with healthcare providers. And so they built a prototype, a video series called Honor My Health, which helps probation officers answer questions about sex and connect youth with resources. So Justice Co has a working prototype. It seems really, really promising. They get some really good early feedback from young people. And they apply and join the Health for All Accelerator program. Health for All helps them build out and execute a plan to conduct pilot testing and early outcome testing of Honor My Health. They also support refining and packaging the innovation itself. And by the end of the time with the accelerator, Justice Co might have a better sense for how their innovation is doing. Say it's showing great promise. They may be ready to move on and in the future apply for a rigorous impact evaluation to say, is this effective? Maybe it's not going well, and that's fine too. So maybe they pause and they consider reapplying to the Futures Incubator program and see if they can turn a lot of their new learnings and data into a new prototype. Now, this ends our time with the grant projects under this funding opportunity, the incubators and accelerators. But to give you a full picture, let's show what other future steps might look like. So by the time they ended the time with the accelerator, let's say that Justice Co has lots of great early evidence, strong logic model, package, and final innovation, and they are well set up to apply for a future impact evaluation. So they work with an evaluation firm, but I've very articulately called the evaluators firm, and they apply for and conduct an impact evaluation. And at the end of their time, they identify evidence of effectiveness. What that means is that this might now qualify them for Tier 1 evidence-based approach status. And so let's say that this new video series is now considered evidence-based, and Tier 1 grantees can select from it to scale to larger populations. And so a Tier 1 grantee called the New Hampshire Department of Public Health, which I had to say because I'm from New Hampshire, decides to select and implement this new video series to scale in all of their youth residential facilities across the state. So like I said, that is just one potential journey, but hopefully it helps make the connections between how all of these different steps and projects feed into and inform each other and help us create a more responsive and impactful TPP program. So let's move on to understand grant expectations. I'll reference a few relevant aspects of the application content and scoring review criteria for you here as well to keep in mind and to just make some more clear connections between them. And please note that these are the expectations of what awardees do. So those who are successful in applying. What we go through now will therefore help you think of the context, background, and future expectations that you would need as you review and prepare the application content and review scoring criteria. So award recipients are expected to meet each of the listed expectations on this slide in the course of the execution of their entire funded project, and I'll go through them one-on-one, but another friendly reminder to read that NOFO in full. So first off is attain planning period milestones. During the first 6 to 12 months of an award, we expect recipients to engage in an intensive planning period in close collaboration with their OPA project officer, their technical assistance liaisons, and of course with each other. The duration of the planning period depends on each recipient's demonstrated progress, but is not to exceed 12 months. The planning period is a time for recipients to check their assumptions that they made in their application, to refine their strategies and prepare for full launch, including preparing for welcoming their first IDT cohort. No hubs should apply with pre-selected IDTs because you will need to have your innovation strategy approved in advance. The NOFO lists out 7 key milestones in this expectation, so please make sure you review that in detail. Failure of a recipient to make satisfactory progress towards completion of these milestones may impact continuation funding decisions beyond year 1. A couple tips here. Your submitted work plan should really make clear how you plan to meet those 7 milestones. You can see that clearly laid out on page 28. Additionally, MOUs are not required with the application, but we may require them in the first 30 days following the project start. So please make sure that you keep that in mind. Next up, clear vision. We expect recipients to demonstrate a clear, enthusiastic, and compelling vision for why and how they will disrupt existing teen pregnancy prevention practice and generate innovation. Hubs should identify and define their own core values that will enable them to foster innovation and advance meaningful breakthroughs in equity. We expect that hubs will uphold psychological safety and creative risk-taking, maintain transparency and open communication, practice innovation discipline, but provide grace, and acknowledge and address inherent power dynamics within this funding structure and their own hub structures. Hubs should also value learning from failure, fostering collaboration, embracing positivity, creating situations where stakeholders are peer collaborators, identify opportunities to balance power and remove barriers that prevent equitable participation, and more. In support of this expectation, hubs should develop and communicate their own compelling value-centric vision statement. Under this vision, hubs should define project success, establish a logic model, or similar graphic illustration charting the relationship between the project's resources, activities, and its intended outputs in service of this vision. Hubs should also fully leverage the power and possibility of the hub's unique, dynamic, phased, and equity-focused approach. Hubs should tap into a deep familiarity, connection, and responsiveness to past and present OPA-funded adolescent sexual health projects, the TPP evidence review, and broader adolescent health field. Hubs should demonstrate their environmental understanding with a living, that means regularly updated, stakeholder map. Hubs should also establish partnerships and feedback loops with the field, including other OPA-funded recipients. So, under at least 2 of the expectations in the work plan, hubs should incorporate strategies that intentionally involve Tier 1 TPP or Title 10 family planning projects in mutually beneficial ways. A couple of the examples we lay out in the NOFO are that hubs might decide to partner with TPP or Title 10 to identify new innovation development team members, to host ideation or concept sessions, to test prototypes, to solicit input, and or to disseminate findings. And we really want this to be an opportunity whereby hubs are building relationships, connections, and feedback loops with the broader field. One note here, vision counts for 20 points in your application. Keep in mind that is a significant portion. On our website, at the very bottom on the right here, you can also see that you have immediate and direct access to all current and past OPA awardees under TPP or Title 10. So you will be able to see everyone who has been funded to do this work and what's emerged from their projects. Next up, each hub should document its specific approach in an overarching innovation strategy. This strategy comprises a significant part of your project narrative. It is scored for 30 points. So this, along with vision, count for half of your application. So please review this section very, very carefully. The strategy is expected to incorporate all necessary elements specific to your incubator, accelerator, or hybrid model. The innovation strategy should cover the hub's theoretical grounding and methods, your cohort timelines, your process visual, aka your developmental phases and how teams move through your innovation development or testing process, your definition of success, your overview of IDTs, and your recruitment processes. Hubs are expected to weave equity principles throughout all phases and strategies. This strategy includes plans related to the 4 components you see here: your team-based approach, your intermediary type, your evaluation related supports you'll provide your IDTs, and your focus. And please know that hubs should not focus on any one priority area, although IDTs can and should based on the experiences of their team. For intermediary types, do read that NOFO very, very carefully. It does lay out in specific detail what's expected of each. I'll quickly provide an overview here. Incubators should support multiple cohorts of IDTs in discovery, exploring gaps in user needs, and building ideas through to prototype. By the end of their time with an incubator, an IDT with a promising prototype should, in theory, be prepared to transition to an accelerator program. It's possible some prototypes may show poor fit or feasibility after going through an incubator. That is totally fine and offers valuable insights for innovation capacity building and learning. While incubators should define their own phases based on research and experience, they should also allow their IDTs to start with exploration of a question or challenge and not jump immediately into solution finding. Accelerators support multiple cohorts of IDTs with existing innovations that demonstrate promise as they rigorously evaluate, refine, and prepare innovations for future evaluation, dissemination, or the next stage as is appropriate. What is promising should be determined and clearly laid out by the accelerator with OPA's input, but should align with theory and accepted scientific discovery processes. Accelerators should communicate to IDT applicants with existing innovation prototypes that they should anticipate ongoing user feedback and should still be open to refinement, iteration, and even failing. All IDTs should employ participatory co-design methods, and accelerators define their own phases and specific activities, but evaluation-related activities should largely be summative. Again, there's also the opportunity of hybrid models, so read more about that in the NOFO. Regardless of all hub types, we expect all recipients to create and maintain a process-oriented visual that documents each EDT's journey through their pipeline. The visual should distinguish clear phases of the innovation process, including what recipients call phases, their timeframes, their end products, and milestones. As part of the approach, we expect hubs to cultivate processes, culture, environments, and prototypes that are age-appropriate, medically accurate, culturally and linguistically appropriate, trauma-informed, and inclusive. Accelerators should institute procedures for ensuring that later stage innovations are medically accurate prior to packaging. And for focus here, hubs, like I said earlier, should not focus innovation development on one priority area. So for instance, a hub should not focus on just identifying innovation teams that serve foster youth. They instead are working with teams with their own experiences, subject matter expertise, and passions to work on innovations relevant for them. And that might include a diversity of interests and focus areas across one single hub's cohort of IDTs, and that is completely okay and acceptable. The Innovation Hub is not supposed to be a subject matter expert in any one population area, but instead be considered an expert in innovation process and related supports. So please do keep that part in mind. Next, we expect that our hubs will identify and provide appropriate supports for IDTs at each stage of their innovation journey through intensive capacity and skill building. Hubs can use a variety of capacity building approaches. Ones we've seen work in the past are mentors, coaches, stage-specific method toolkits, such as worksheets, assessments, templates, and peer and cohort-based learning, training, and other types. Hubs may also incorporate outside subject matter experts throughout the course of the project to meet evolving IDT needs. And hubs with external SMEs or trainers should establish appropriate agreements, such as MOUs. We expect that Hub's IDT capacity building to address diverse topics that best meet the needs of each team and cohort based on where they are in their innovation process. For example, incubators may decide to build IDT capacity around creative confidence, question framing, building logic models, pitching ideas, facilitating youth focus groups, soliciting youth input, and early testing methods. Accelerators, on the other hand, might decide to focus on capacity building around later stage testing methods like piloting or preliminary effectiveness testing, branding and packaging, dissemination, and implementing sustainability strategies to advance innovations beyond the accelerator. To measure progress in cultivating innovation capacity and inform course corrections, we do ask that hubs adopt, create, or adapt an innovation capacity assessment tool for IDTs to include as part of their onboarding and offboarding. Based on pre and post findings from these assessments, hubs should make necessary changes to the supports and processes they provide for IDTs to ensure that they stay on track in helping IDTs develop skills and confidence and innovation mindsets. Next up is learning and propagating findings. Hubs should commit to intentional learning and dissemination in pursuit of their broader vision. We are very serious when we say dissemination is an ongoing, strategic, and adaptive activity. It is not an end of project activity. Hubs should coordinate both a learning agenda and a broader dissemination strategy. In the learning agenda, the hub should maintain and continually execute hub project level learning agenda designed to ask and answer thoughtful questions about their unique approach to fostering innovation. The agenda should include learning questions, learning activities, and anticipated learning products. In the dissemination strategy, hubs should prioritize disseminating IDT innovations and innovative practices, but should also be sharing emerging stories about the hub's overall innovation process, formative findings, and failures. The dissemination strategy should identify diverse audiences. Hubs should frequently promote innovations showing early promise and not wait until they undergo impact evaluation, which of course, as you see, is not part of this grant. Hubs should incorporate and uplift IDTs, community members, and young people as powerful co-messengers and co-creators of the messages of their shared experience. By the end of the project, as part of the final report, recipients should complete a final Innovation Hub package that documents the overall hub approach, as well as the overall project learnings. And we'll share much more guidance as we get closer to the final year. Promise you we're getting close to the end of these expectations. The hub should conduct rigorous program monitoring using data to understand whether its project is meeting its benchmarks and make ongoing improvements based on those findings. Monitoring should include collecting, analyzing, addressing, and reporting on performance measures. And you can check out some of those example anticipated performance measures in section I-7 of the NOFO. Hubs should also develop their own definition of success for an innovation project, one that's adaptive and tailored to their experience, and measures that align with that unique definition. Hubs should align measures related to outputs and outcomes in their own logic model and learning agenda, and look to ours as a starting point. We will review and provide feedback on all project-specific measures as part of that planning period and during the project as necessary. The NOFO includes lots of fantastic resources for you to review and get some ideas and inspiration for this part of your project. So check them out in the end, section I of your NOFO. And finally, our final expectation is project management. Project success hinges on the capacity, culture, and experience of the hub and its core staff with managing a complex innovation project. In other words, experience and capacity really matters with a complex and adaptive project like this. Therefore, while hubs may recruit innovation teams with little to no experience in innovation, the hub itself should demonstrate significant innovation, experience, and success. To support coordination across all project deliverables and activities, the recipient should maintain an annual work plan with clear goals, SMARTY objectives. Again, see the resources, including a SMARTY work plan template and timelines. We have lots of fantastic resources for you. So like I said, check out sections I-8 and I-9 of the NOFO, or visit the TA Center on rhntc.org, which is our public-facing training center. All right, very last section, and then you get to hear from Dwayne. Federal award information. This is section B of the notice. OASH anticipates having 11,475,000 available each year to fund innovation hubs. Hubs may request between 1 and 2 million for their budgets each year, which means we anticipate about 6 to 8 total hub projects. Applications are due June 13th by 6 p.m. Eastern. Do not wait to start your application, to start your SAM registration. Dwayne will go over that next, but I cannot impress upon you enough how important it is to start now and get done early in case you hit any technical roadblocks along the way. We anticipate awardees will begin their projects on September 1st of this year, and projects have an estimated period of performance of 5 years, with each budget period lasting 1 year. So we did have a bunch of folks tell us early on that this was their first Tier 2 TPP program grant that they would receive, which is fantastic. So that's possible that our type of funding award is new to you. Awards made under this particular NOFO are called cooperative agreements. A cooperative agreement is a form of assistance that allows for substantial involvement by the program office, aka OPA. And this type of involvement is in addition to usual monitoring and technical assistance provided under a grant project. So you can see the specific terms for substantial involvement laid out in the NOFO, and you can see them here. They include everything from prior approval of change of time for key personnel dedicated to the project or their replacement, to recommendation of opportunities for technical assistance, to ensuring the recipient has a process for ensuring materials are medically accurate, and everything in between. Read this carefully and get a sense for the ways in which that OPA looks forward to collaborating and supporting our awardees under this project. And with that, you all get a probably much needed break from hearing from me. Oh, no, I spoke too soon. We have one more with me. Apologies. This one will be really quick. It's just 2 slides. So application content and review criteria. So as you can see on this slide, this is the breakdown of what you'll submit as part of your application content from a programmatic lens. Right? So you have the project narrative broken down into 4 parts, and you have your appendices laid out here. Rather than walk through this all in detail, read this verbatim, which is what I would have to do if we walk through this. I've clearly outlined exactly the page numbers that you need to look into to fully understand each part of your content of your application. So for instance, you have vision, innovation hub approach, learn and disseminate and manage project as part of your project narrative. This is your clear and concise description of your project. And then we have the appendices that we laid out here. So your work plan, which covers all project years, not just the first one, and includes SMARTY objectives. You can submit any MOUs or letters of commitment that you have now. Again, not required, but we may require any new MOUs within 30 days. CVs for key personnel as defined, references cited, your logic model, and stakeholder map. And scoring criteria. Make sure you know this section, section E1, front to back. This is everything you need to know about how your application will be scored by our objective review committee. So make sure you look at this and make sure that you are comparing this section to what you include in your application. Think about the breakdown in points and what they tell you about what matters, what to highlight and focus on. This is a scoring breakdown. Your vision accounts for 20 points of your application. Your approach and your innovation approach, including your theoretical underpinning and structure and teams, counts for 30. Your learning and dissemination section counts for 20 points. And your project management, including experience, partnerships, and management tools, counts for 30. So, like I said, carefully review these two sections and ask questions about them if you need clarity. And now the part you've all been waiting for is for me to stop talking, and I will turn it over to Dwayne Barlow, who will lead us through the administrative and financial part of this presentation. Dwayne, it's all yours.
Okay, thank you very much. Good afternoon, everyone. Again, my name is Dwayne, and at this point, we are going to discuss eligibility information. Next slide, please. So, eligible applicants would be any public or private, profit or nonprofit entity located in a state, which includes one of the 50 United States, the District of Columbia, the Commonwealth of Puerto Rico, the U.S. Virgin Islands, the Commonwealth of Northern Mariana Islands, American Samoa, Guam, the Republic of Palau, the Federated States of Micronesia, and the Republic of the Marshall Islands are eligible for this grant, as well as faith-based organizations and American Indian, Alaskan Native, Native American organizations that are public or private entities. Also, public and private community-based organizations are eligible applicants. Next slide, please. And on this slide, I won't go through every example, but this is a list of the examples of eligible applicants in practice. Next slide, please. Cost sharing or matching on the project. So you're not required to provide cost sharing or matching in your proposed budget. If you voluntarily include cost sharing in your application, you must include in your budget narrative a non-federal sources justification. During the merit review of an application, cost sharing will only be considered in the overall review of the adequacy of the total proposed budget, that's federal and non-federal share, to support the project proposed. Applications including voluntary cost sharing or matching that result in an award will include the cost sharing or matching commitment on the notice of award at the level proposed in the application. Any change in that commitment will require prior approval of the grants management officer. Next slide, please. Application responsiveness criteria. So we'll review your application to determine whether it meets the responsiveness criteria below. If it does not meet this criteria, we will disqualify your application from competition. So the responsiveness criteria are as follows. Your application must clearly identify the type of project being proposed in the project abstract and on the first page of the project narrative. An organization may submit applications for multiple projects, but only one application will be funded for any organization. Next slide, please. Application disqualification criteria. So if your application does not meet the following requirements, it will be disqualified and receive no further consideration. So the application has to be submitted electronically via grants.gov by due date and time, unless an exemption was granted 2 business days prior to the deadline. If you successfully submit multiple applications for the same project, we will only review the last application received by the deadline. You must complete the required forms in the application package, that is SF-424, SF-424A, the SFLLL, the project abstract summary. Your application must be submitted in the English language and must be in the terms of US dollars. Next slide, please. So your project narrative must be double spaced on the equivalent of 8.5 by 11 page size with 1-inch margins on all size and font size, not less than 12 points. Your project narrative must not exceed 50 pages. The total application, including project narrative, must not exceed 100 pages. Your federal funds request, including indirect costs, should not exceed the maximum indicated in the award ceiling per budget period, which is $2 million. Your federal funds request, including indirect costs, must not be below the minimum indicated in the award floor, which is $1 million. Your application must meet any of the application responsiveness criteria under section C3, other application responsiveness criteria. And keep in mind that if you included any voluntary cost sharing or matching, you must include in your budget narrative a non-federal sources justification. Next slide, please. Okay, application and submission information. The address to request application package. You can obtain an application package electronically by accessing grants.gov at the blue URL that you see on the screen. You can find it by searching the assistance listing, formerly CDFA number, found on page 1 of the NOFO. So the assistant listing or the CFDA number is 93.297. Subscribe to the announcement in grants.gov so you receive notification of any updates to the NOFO or supporting documents. Next slide, please. So, application submission. OASH requires that all applicants be submitted electronically via grants.gov unless an exemption has been granted by the grants management officer. Applications submitted via any other electronic communication will not be accepted. Keep in mind the grants.gov is a website portal. All funding opportunities and grant application packages are made available on grants.gov. Your application will not be considered valid until all application components are entered in grants.gov and received by OASH Grants and Acquisitions Management, or GAM, division during the deadline specified in the dates section of the NOFO. You can contact grants.gov with any questions or concerns regarding the electronic application process by using the number on the screen. Next slide, please. Application submission continues. So applications must be submitted in 3 files. File 1 should contain the entire project narrative. File 2 should contain the entire budget narrative, including supporting documentation described in the budget narrative content section. And file 3 should have all documents in the appendices uploaded in the attachment section of your grants.gov application. The required standard forms, or SF forms, do not apply towards your page count limitations in the submissions requirements as stated in the disqualification criteria. Next slide, please. So any files uploaded or attached to the grants.gov application must be in the following file formats. So you can use Microsoft Word, PowerPoint, Adobe PDF, or any of the image formats like JPEG, GIF, TIFF, or BMP only. Microsoft Excel files will not be accepted. HHS strongly recommends that electronic applications be uploaded as Adobe PDF. If you convert to PDF prior to submission, you may prevent any unintentional formatting that might occur with the submission of an editable document. Check the page count of your PDF and/or print the file to ensure that the document doesn't exceed the page limit. Next slide, please. Please be complete and do not leave blanks on forms unless the information is clearly not applicable. The individual submitting the application forms must have the legal authority to act on behalf of your organization. Next slide, please. To ensure successful submission of the application, carefully follow the step-by-step instructions provided at the URL that you see on the screen. These instructions are kept up to date and also provide links to frequently asked questions and other troubleshooting information. Next slide, please. Okay, so your application elements, really quick, your forms, the application for federal assistance, the SF-424, the budget information for non-construction programs, SF-424A, the disclosure of lobbying activities, or SFLLL, and the project abstract summary. For your files, project narrative, submit all your project narrative content as a single acceptable file. For the budget narrative, submit all budget narrative content as a single acceptable file. For your appendices, submit all appendix content as a single acceptable file in the attachment section of your grants.gov application. Next slide, please. Okay, so for your project abstract summary, you must complete the project abstract summary form provided in the application package. The abstract will be used to provide reviewers with an overview of the application and will form the basis for the application summary and grants management and program summary documents. If your project is funded, HHS will publish the abstract from your form on tags.hhs.gov and usaspending.gov. The abstract may also appear on the program office website or other government websites, so please do not include sensitive or proprietary information in your abstract. Next slide, please. So, application format. Please be sure to follow project narrative format instructions in the NOFO. Your application will be disqualified if it does not conform to the format requirements. You must double space the project narrative pages. You must use 12-point font. You should use an easily readable typeface such as Times New Roman or Arial. You may single space tables or use alternate fonts, but you must ensure the tables are easy to read. For appendices in the budget narrative, you should use the same formatting specified for the project narrative. Appendix documents such as resumes may use alternate formats common to such documents. Next slide, please. The UEI number in the System for Award Management, or SAM. So to register your organization, you'll need a unique identity identifier, or UEI. So on April 4th, 2022, the federal government completed its transition to the 12-digit UEI number as a required UEI for registration in SAM.gov. You may begin the registration process, including receiving your UEI at the blue URL that you see below. An entity registration checklist is available again at the blue URL that you see on the screen. You may register in SAM as either an entity applying for federal assistance awards only or all awards. Next slide, please. Okay. If you're registering for a new entity in SAM.gov, you'll need to create a login.gov account if you don't already have one. Keep in mind that the minimum time frame to complete an initial SAM registration online is 30 minutes. The time frame for an applicant's registration to become active is up to 10 days and may take longer depending on volume, or if the SAM system flags the information you provide as needing manual validation. The average time frame for updates in SAM to appear in grants.gov is up to 72 hours. If you plan to apply for this funding opportunity or think you might apply, you should ensure your organization's registration is active in SAM well before the application deadline and will be active through the competitive review period. Next slide, please. Your SAM registration must be renewed each year. If you are renewing your registration, your old SAM.gov username and password may not work anymore, so you'll need to create a login.gov account if you don't already have one. Next slide, please. We strongly recommend that applicants check for an active registration in SAM well before the application deadline, so do it right now, do it as soon as possible. If you're successful and you receive an award, you must maintain an active SAM registration with current information at all times during the active award. If you've not complied with the SAM registration requirements, HHS may determine that you're not qualified to receive an award and may use that determination as a basis for making an award to another applicant. Should you successfully compete and receive an award, all first-tier subaward recipients must have a UEI number at the time that you, the recipient, make a subaward. Next slide, please. Now, when an organization gets a SAM registration, they get their record in SAM, and that record will show a valid UEI number, an entry stating that they have an active registration. Usually it'll be like a green box, and a cage code, right? Please ensure that you have a green box within SAM. That indicates that you have an active registration. If you don't see that, you don't have an active registration. Next slide, please. If you encounter an issue with your cage code issues usually take 5 business days to resolve if the applicant has all their documents to verify their organization and clear up the discrepancy. Once it's completed, grants.gov can take up to 3 days to update their system so that the applicant can make and submit an application in grants.gov. Unfortunately, there's no alternative route. The only solution is for applicants to start the process early and work out any submission issues. These resolve any CAGE SAM issues well in advance of funding or the funding opportunity actually closing. Next slide, please. So it's not enough to just go on the website and register. WASH will not provide an extension just because you did not complete full registration on time. If you need support, you can contact the Federal Service Desk directly. You can visit www.fsd.gov to search frequently asked questions, chat live with the support agent, submit a web form, or call for assistance. And below, you see the information that you need in terms of times and where you can call. Next slide, please. Funding restrictions. So if you're successful and you receive an award, by accepting the award, you agree that the award and any activities they're under are subject to all provisions of 45 CFR Part 75, currently in effect or implemented during the period of award, other department regulations and policies in effect at the time of the award, and applicable statutory provisions. Keep in mind that your costs must be allowable, allocable, reasonable, and necessary direct expenses or indirect costs in accordance with regulations and current policy. Indirect costs may be included per 45 CFR 75.414. An applicant should indicate which method or rate is used for this application. Keep in mind that pre-award costs are not allowed. Next slide, please. Budget narrative and forms. Keep in mind that they must be consistent with the requirements of the NOFO. Budgeted costs must reflect proposed activities. Budget line item descriptions and justification requirements are explained in NOFO. Suggested table formats are also described in the NOFO. You also want to keep in mind your oversight of federal award funds. Also, you want to remember that forms, budget narratives, and detailed justifications don't count towards your page limit. Next slide, please. Budget narrative and forms, tips for development. You must develop an itemized budget using Section B, Box 6 of the SF-424 for the first year of the proposed project. For awards with an anticipated period of performance of 1 year or less, this will be the budget request for the entire project. Provide a budget justification, which includes explanatory text and line item detail for the entire first year of the proposed project. The budget narrative should describe how the categorical costs, for example, salary, equipment, supplies, and consulting costs, are derived. Discuss the necessity, reasonableness, and allocation of the proposed cost. Next slide, please. For subsequent budget years in an anticipated multi-year project, provide a summary narrative and line item budget for each year beyond the first. For categories or items that differ significantly from the first budget year, provide a detailed justification explaining these changes. Do not include costs beyond the first budget period in Box 6 of the SF-424A or Box 18 of the SF-424. The amounts entered in these sections should only reflect the first budget period. Next slide, please. Indirect cost methods are described again in 45 CFR 75.414. This category has one of two methods that you can select. You may select one and must clearly identify that selection in your submitted budget. If your organization currently has an indirect cost rate approved by the Department of Health and Human Services or another cognizant federal agency, you should enclose a copy of the current approved rate agreement in your budget narrative file, An applicant that's never received a negotiated indirect cost rate may elect to charge a de minimis rate of 10% of modified total direct costs, which may be used indefinitely. If chosen, this methodology must be used consistently for all federal awards until such time as an applicant chooses to negotiate a rate. Next slide, please. If your proposed budget requests a rate that is less than allowed, your authorized representative must submit a signed acknowledgement that the organization is accepting a lower rate than allowed. If you want to obtain a negotiated cost rate with the federal government, you can contact the U.S. Department of Health and Human Services Cost Allocation Services regional office that is applicable to your state. The CAS regional contact information is available at the blue URL that you see on the slide. Next slide, please. Right here is a quick application review information flow chart. I'm not going to read every single one, but it gives you an idea of the process of application review. Next slide, please. Application merit review. So eligible applications will be reviewed and assessed by a panel of independent reviewers with technical expertise in applicable fields according to the criteria listed in the NOFO. The merit review process is formal and confidential. Federal staff are available to answer questions and to ensure the process is consistent and fair, but we do not participate in discussion and assessment of the applications. Okay, then the applications are reviewed first by GAM staff and for administrative or business compliance, and then by the OPA program office staff for programmatic compliance. Next slide, please. Okay, funding decisions. So the Deputy Assistant Secretary for Population Affairs will make final award selections to be recommended to the Grants Management Officer for risk analysis. In providing these recommendations, the Deputy Assistant Secretary for Population Affairs will take into consideration the following additional factors. So balance of hub types, incubators, accelerators, and hybrids. Next slide, please. On completion of risk analysis and concurrence with the Grants Management Officer, HHOASH will then issue notices of award. No award decision is final until a notice of award is issued, and all award decisions, including level of funding, if an award is made, are final and you may not appeal. Next slide, please. We're not obligated to make any federal award as a result of this announcement. Only the Grants Management Officer can bind the federal government to the expenditure of funds. And if you receive communications to negotiate an award or request additional clarifying information, this doesn't mean that you'll receive an award. It only means that your application is still under consideration. All award decisions, including level of funding, if an award is made, are final and you may not appeal. Next slide, please. Okay, the funding process as it relates to review of risk posed by the applicant. So HHS-OASH will evaluate each application in the fundable range for risks posed by the applicant before issuing an award in accordance with 45 CFR 75-205. OASH will use a risk-based approach and may consider any such items such as the following stated in the NOFO. So we'll take a look at the applicant's financial stability, the quality of management systems, and the ability to meet management standards, the history of performance. We'll look at reports and findings from audits performed, and we'll look at the applicant's ability to effectively implement statutory, regulatory, or other requirements imposed on non-federal entities. Next slide, please. Plan for oversight of federal awards. If your internal controls are available online, you may provide a link as a part of your plan in the budget narrative. We've also included supplementary materials in section I2, which contains questions applicants may find useful in considering their plan for oversight of federal funds. Next slide, please. Non-funded applications as a result of risk review. So if we determine your organization does not meet either or both of the minimum qualification standards as described in 45 CFR 75.20582, and we do not make an award to you as a result, we must report that determination to FAPIS if certain conditions apply. Keep in mind that the information reported in FAPIS is available for other organizations to review when considering you for an award. Next slide, please. So now we get to the notice of award. So if a successful applicant receives a notice of award, they are again notified of a successful applicant selection. You're made aware of the award amount, the project, and budget periods. It includes any conditions on the award, and it includes standard terms, reporting requirements, and contact information for OASH GAM and the program office. Next slide, please. When to contact. Keep in mind that GAM is the official contact for awardees throughout the award lifecycle. All official communication related to the award is between GAM and the successful applicant. Unsuccessful applicants will be notified by the program office via letter. Next slide, please. So, summary and tips. Project narrative description. For your project narrative description, you want to be clear, complete, and concise in the project description. Follow and address exactly what is requested in the NOFO. Don't make the reviewer search for the required information. Generally, the easier the application is to review, the better the score or the rating. Keep in mind that reviewers are not allowed to do external research or follow embedded links. Clearly identify the sections of the application and indicate which component is being addressed. The project narrative must include all required information within the page limit. Do not use appendices to expand the page limit. Next slide, please. Make the goals and objectives for your project SMARTY, or specific, measurable, achievable, relevant, time-bound, inclusive, and equitable. Activities presented in the work plan should relate directly to the proposed goals and objectives of the project. The program work plan, evaluation plan, and budget should provide a complete picture of how the applicant will address the needs, as well as address the purpose and expectations in the NOFO. Next slide, please. With regard to staffing on the project should be appropriate and reasonable for the goals, objectives, and activities of the proposed project. Please be complete in describing what the staff will do, the expertise required, and the percent time they will be assigned to the project. Next slide, please. For your budget, the budget should include adequate funds to carry out the proposed work plan, the evaluation plan, and the administrative responsibilities of the project. The budget should be reasonable and relate directly to the goals and objectives of the project. Do not request more funds than are available as listed in the NOFO. This amount is inclusive of indirect cost. The operating budget should be complete and include federal and non-federal funds and projected program income, And for example, that would be fees and third-party payers and other contributing funds. Next slide, please. So, summary and tips from an overall perspective. In your applications, please include full names, first, middle, and last of four authorized officials, principal investigator, and project directors, and all essential personnel. Don't forget to submit your application electronically, and keep in mind the electronic submission is required. Don't wait until the last minute to begin SAM registration or to update your registration. Don't wait until the last minute to begin electronic submission. At this time, I'd like to turn it back over to Liz, who will handle our closing. Thank you.
Wonderful. Thank you so much, Dwayne. So in our final remaining slides, here's your other chance to get in some of these questions you have about either the administrative and financial aspects of this grant or the programmatic aspects. If you have any questions, remember, you can reach out directly to the email addresses that you see on the screen. A friendly reminder, do not contact OSH program or grants office for grants.gov issues. Those should go directly to the grants.gov contacts that you see here on the screen. A quick note that we do want to flag is, like we mentioned early on, we do have an upcoming webinar on Wednesday, April 26th that is not tied to, but does contain helpful information about innovation evaluation. The formative evaluation approaches appropriate when developing an innovative intervention webinar will take place on April 26th from 3 to 4 p.m. Eastern Time. Registration is required, but it is open to the public, and Minju is very thoughtfully dropping that registration link into the chat box. So please do check it out. We also highly recommend that you check out all of the resources that are available in section I of the Notice of Funding Opportunity. So for instance, you can see acronyms. We know government funding is in alphabet soup sometime. This is a great place to go to be like, who is OSH and GAM and OPA and who are all these partners? Check that out there. We also have great resources under appropriate evaluation activities for each hub type. We have 3 different visual figures to help you think about the TPP continuum, the IDT sources, and the logic model. We have authorizing language about TPP, so you can see where we get our congressional mandate. We have our sample performance measures and a number of optional templates for you to use if you'd like, including a work plan, MOU template, and logic model. And then we have a number of other resources that we have really enjoyed, used, or shared with our current and past Tier 2 cohorts. All of these are just there for your use, and hopefully we'll be able to share more as time goes. And last but not least, we do have our glossary on the final pages of this NOFO. So as we wrap up, a couple reminders. Again, we are here to help as you prepare for your application of this NOFO. You have all of our email addresses to ask questions. You have the grants.gov webpage. You know how to subscribe to it, so you get alerts when we post Q&As. And you also have the webinar coming up in 2 days. I've been lucky enough to see the types of questions that we're getting in the chat box today. Keep them coming, keep sending them to our email addresses. One thing I'll note is that many of them are answered in the NOFO. So that is great news for you. You do not have to wait for a Q&A to come out. Open up that NOFO, do a Control F to find what you need, and let us know if you have any other clarifying questions. And hopefully that'll be really helpful for you. Otherwise, we look forward to sharing more clarifying answers in the next week or so. As we conclude, I want to thank Dwayne, our incredible partner at GAM. I want to thank Diana, who has been offering Spanish interpretation services for us, my colleagues, Minju, Jackie, and Jacqueline for helping to provide troubleshooting, and Bill Foster, our colleague as well, who has helped me deal with some technical issues today and been very kind and supportive about it. We look forward to reviewing and receiving your application soon. Happy innovating and have a wonderful evening. Thank you so much.